Kundu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open maternal and child health clinic. Please, when you come in, announce your name, announce your location. If you can see me, you can give me a thumbs up. I can see my admin is standing by, and we're just going to get ready and get the clinic started. Today's topic is going to be predominantly related to pregnancy. So if you're pregnant, you want to be in this gathering right now because we're talking about a factor which can affect your pregnancy. So please, if you know anybody in our group who is pregnant, currently invite them. We're talking about the foods and beverages you have to avoid in your pregnancy. Very, very important. So I'm going to sit back and see the number we can generate. So I normally love starting around 50. So I'm going to start with my presentation. Afterwards, I'm going to take care of your questions. So the clinic today is predominantly going to be based on pregnant women. We have beverages you're supposed to avoid in your pregnancy so that your pregnancy will go smoothly. So please, when you come in, announce your name, announce your location, then make sure you can hear me clearly. If you can hear me clearly, give me a thumbs up. We'll soon start the clinic. Okay? So thank you so much, admin. Quickly settle in and make sure you're ready. Keep your questions until my presentation is over. I'm going to take care of your presentation. Now, remember, yesterday we launched our masterclass for the month of January. How you start your new year is very important. So how you start your January will determine how your February will be, will determine how your December will be. Now, we understand that so many of our members are having infertility. Remember that infertility can be female infertility, it can be male infertility. Now, if you have been struggling to become pregnant, you are 35 years and above, and since last 6 months, you were not able to achieve pregnancy, you have a problem. If you are below 35 and you have been doing the right things, you have been praying, you have been playing, and you have been practicing, and let's assume since January 2021 up to December 2021, you couldn't achieve becoming pregnant, you have a problem. The problem is called infertility. Now, for the month of January, we have 3 subject matter specialists. I'm going to be in the panel. My good friend and my classmate, who is currently an OBGYN in UK, will be our guest presenter. So we're going to dissect infertility. We're going to look at the female infertility. We're going to look at the male infertility. We're going to look at how we can help you to become a mother, to become a father in 2022. You have gone through a lot. We can no longer afford to see you go through the same thing you've been going through. Some people have been looking for babies for 20 years, some 15 years, some 10 years. We cannot continue that way. So that particular masterclass is something that will help you. Start your January the right way. Start your January getting the knowledge you need, changing your attitude, changing your practices, changing your perception, relating to a fertility specialist, doing everything within your reach to defeat infertility. You're going to become a mother if you can do this. So admin is going to share the links for that particular event. I will encourage you to register. The earlier you register, the better. It's going to be on the 30th by 9 p.m. Nigerian time. Now, if you also want to talk to me regarding your issues, of which infertility is the major issue that bother our people, you can also follow the admin. You can decide what you can afford. If you can afford 1 week, if you can afford 1 month, if it's 3 months, if it's 6 months, please tell the admin, sign up. We have 2 providers. When you sign up and you want to be under me, you can indicate and we will walk with you. Now, we have a couple of places we can refer you to. So if you're in Abuja, in Asaba, in Oka, in Benue, Calabar, Enugu, Jos, Kano, Kogi, Nnewi, Osun, Owerri, and Podaka, we can refer you. Now, you need to be mindful the doctor you're going to. There are so many people that claim to be fertility specialists, but they are not fertility specialists. So we've taken time to identify user-friendly, result-oriented fertility specialists in the locations I mentioned. But even if you're not in that city, make efforts to go. So assuming you're not in Enugu, you're in Abakaliki, please go to Enugu and see the person I will refer you to. But by any means, do everything within your reach to become a mother, to become a father in 2022. But today we're talking about pregnant women. What are those specific food items you are supposed to avoid? And I'm also going to start by dispelling that myth about eating for two. That's a wrong conception. Very, very, very misconstrued either. When you're pregnant, there are healthy body weight you're supposed to add so you can take good care of your baby. But you don't eat for two. You need to be careful. There are so many pregnant women that are overweight. There are so many pregnant women that their BMI is very high. And when you have that problem, you have already started putting your baby in danger. So be mindful of the food you consume. Very, very important. So I'm actually going to start. I'm sure you can see my screen. The reason why I wanted to share the screen is to make sure I take time to explain the things you need to understand better. Okay, so I'm going to start. So you see, one of the first things as a pregnant woman, you will learn. A lot of people will tell you, oh, eat this, don't eat this. So there are so many people that will be advising you on what you need to do in your pregnancy. Take this drug, don't take this drug, go here, go there. One of the key things most pregnant women will ask is, what can I eat and what can't I eat in pregnancy? It can be a very, very big challenge. If you're someone that loves sushi, if you're someone that loves coffee or you love steak, and suddenly you have to be mindful of what you're eating. Now, thankfully, there are so many more food you can eat than what you cannot eat. So let me put it in bigger perspective. The choices of food you can eat is way, way, way bigger than the choices of food you should avoid. So I'm going to mention about 13 foods you should avoid, but there are also so many other food items you can eat and you will be okay. Now, the problem is 9 months is a long time. You don't want to put your baby in danger within these 9 months. You don't want to put yourself in danger. So you're the person that is carrying this amazing baby. So you need to be careful. So be very, very careful in choosing what you eat. Everything I'm going to mention this afternoon, it's very important. You have to learn how to navigate the waters, especially if things you love eating, you can no longer eat them now. So there are so many things you might also be craving for. For some pregnant women, they might even be craving for certain things that might not have any nutrient in them. Some of them might be craving ice. Some of them might be craving sand. Some of them might be wanting to eat stuff that can put them in danger. Now, some women might be fond of eating poorly cooked food or raw food. When you're pregnant, you don't want to go there. So you need to pay attention to what you eat and what you drink. Certain food, when you consume them, might put you in danger. So some food should be avoided completely. Then some you have to take them minimally. Now, the very first food which you have to be careful with consuming is what? Fish. The reason why we want you to be careful with fish is because of mercury. So any food item that contain high mercury, it's very toxic. Mercury is a toxic element. Now, there is no known safe level you have to take. It's mainly found in polluted water. So there is no, oh, take this small quantity, oh, take this big quantity. We are better served avoiding it completely. When you have your mercury in high amounts, it can be toxic to the nervous system. So the nervous system is the system where your baby's brain and spinal cord will develop. So you don't want your baby to have problems in the brain. You don't want your baby's spinal cord to have problems. So when you have fish that contains a lot of mercury, it can affect the immune system, the nervous system, and the kidneys. Your immune system is what will help you to make sure you don't get infections. When your immune system is down, you can have any infection. When your kidneys are down, your kidneys can fail. Now, there are also some developmental problems in a baby. So if you happen to survive that pregnancy, subsequently, the time your baby is supposed to develop, to talk, to walk, to run, your baby might be challenged. So there are some developmental problems that some babies will have based on what you ate during pregnancy. So any fish that contains high mercury, avoid it. Now, most polluted body of water is in the sea. So you have to avoid large marine fish because they have higher concentration of mercury. So I'm going to painstakingly mention the type of fish you have to completely avoid during pregnancy and while breastfeeding. Number one is the shark. I know you'll be wondering, oh, shark? Yes. Shark, no-go area. Now, another type of fish you have to avoid is swordfish, mackerel, tuna fish, marlin fish, and tilefish. So any of these fish, if you have it in your location, please avoid them. Do not consume them in your pregnancy, both in your first trimester, second trimester, and third trimester. Now, in as much as we encourage you to avoid high mercury content fish, also consuming low mercury fish can also benefit your pregnancy. So there are some types of fish you can eat, and it will help with a couple of things in development of your baby. Now I'm going to mention them. So the fish I'm mentioning now are low in mercury: cod fish, haddock, salmon, tilapia, trout. So if you're in Nigeria, you're conversant with tilapia. If you're outside Nigeria, maybe salmon. So if you can have salmon and tilapia, that's okay. Now, the big thing, the advantage of having salmon as part of what you eat during pregnancy is the fact that it contains high level of omega-3 fatty acid. And omega-3 fatty acid is very, very important for your baby and yourself. Okay? Very, very important. So number one food to avoid during pregnancy is what? Fish with high mercury. Now, number two, food, undercooked or poorly cooked or raw fish or meat. So some people love eating raw things, sushi, poorly cooked. That's how they love doing their things. Now, it's going to be difficult for you if you've already been addicted to sushi. Once you are pregnant, you stop. You don't go there again. Now, raw fish, especially shellfish, can be a source of several infections. So you can have bacterial infection, you can have parasitic infection, you can have salmonella infection, which is the popular typhoid, when you eat undercooked, raw or poorly cooked fish or meat. So avoid them. Now, some of the infection might just make you to be vomiting, weak, stooling, and all that. And once we address that, you'll be okay. But some can affect your baby in a very deadly way. Some can actually lead to the death of your baby. Now, especially bacteria. Some bacteria in this poorly cooked food can threaten the health of your little one, leading to stillbirth, leading to miscarriage, leading to epilepsy, leading to blindness later in life. So you can imagine, because of what you ate during your pregnancy, when your baby is born, your baby will be born with brain disorder, blindness, epilepsy. You don't want to have a baby that will be challenged because it's going to break your heart. So while most bacteria are found on the surface of this food, some are on the inside. So if you have to eat your fish, if you have to eat your meat, it must be well prepared. It must be fully cooked. The same thing is applicable to raw eggs. So please do not consume raw eggs. Raw eggs can directly lead to salmonella typhi, which is a typhoid. It can present with vomiting, it can present with stomach ache and diarrhea and all that. It's very rare, but this can lead to problems, including leading to miscarriage and stillbirth in your baby. You don't want that to happen to your baby. Now, the next food item you have to avoid is organ meat. So what do I mean by organ meat? I'm sure you're conversant with the liver. I'm sure you're conversant with the spleen, with the heart. So when you're eating your food, when you're eating your meat, be conversant with the organ meat. Understandably, they are a very good source of nutrients like iron, vitamin B12, vitamin A, zinc, selenium, copper, which are all good for you and your baby. But be mindful, eating too much of them, especially the vitamin A, can have a problem in your baby. Vitamin A is helpful, but when you have excess vitamin A in your body during pregnancy, it can affect the outcome of that pregnancy. So consuming too much vitamin A can lead to a problem in the first trimester. The trimester that most women will have problems in regards to their pregnancy is first trimester. First trimester is when most women will have miscarriage. Some will have stillbirth, about that period, and so many other things. So if you can navigate through the first trimester, you're in a good place. Now, by default, avoid caffeine. Now, I know we are still studying this. We don't know the range that you save and that, but I will personally tell you to do what? Avoid it completely. I know you love your cup of coffee, your cup of tea, soft drinks, and all that. When you want to drink anything, read the label. Possibly avoid coffee completely. You can do your tea. Make sure your tea is herbal safe tea. Very important. Now, avoid your soda and all those carbonated drinks. When you are avoiding alcohol, you should also avoid this. You definitely need to be careful. Pregnant women in America are generally advised to limit their caffeine intake to less than 200 milligrams per day. But how will you know? How do you know where to draw the line? So personally, I would say don't go there. Caffeine is quickly absorbed and it can easily get to the placenta. And the placenta is the structure that will help your baby to receive nutrients, to receive oxygen, and thrive properly. Anything that affects the placenta can affect the outcome of your pregnancy. So please avoid your caffeine 100%. Now, when you're drinking your milk and your cheese and your fruit juice, make sure they are pasteurized. Make sure they are preserved properly. So no unpasteurized milk, no unpasteurized cheese, and your fruit juice, if you're going to drink it raw, be mindful. It must be fully harvested, fully prepared, and preserved. Definitely no alcohol. You don't need your alcohol. Now, unwashed food items. If you're going to eat your fruits, if you're going to eat your vegetables, you must wash them properly. There are so many bacteria, there are so many viral, there are so many parasitic infections that can be in your food items when you don't wash them properly. So avoid them completely. Make sure you wash your food items completely. Now, so many pregnant women crave for so many junk foods. You don't necessarily need anything junk right now, because when you're consuming a lot of junk foods, they are highly processed food and you don't derive the adequate nutrient you need for you and your baby. So avoid highly processed junk food. So what are the examples? Your pizza, your cake, your Fridays, your Friday, any food you're ordering outside, which you're not really there when they prepared it, is actually in the category of junk food. So you are better served staying back home, preparing your food. Now, there are no other time to talk about the outcome of your pregnancy, if not now. So there is no better time to start eating nutrient-dense food to help you and your baby, if not now. So you need to increase the amount of essential nutrients. So the key word is what? Essential nutrients. So your protein, your folate. Remember, when you're taking your prenatal multivitamins, you're getting your folic acid, which will help the baby's brain and spinal cord to develop properly. Your choline and your iron. You definitely need your iron so that you won't have anemia. When you have anemia, you might have complications in your pregnancy. Now, the myth of eating for two, by now you should know that this is not true, okay? So eating for two is something that some old fairy tale stuff they tell women that are pregnant. Oh, you're pregnant, eat for this, eat for that. Be careful. You can still eat your normal food during the first trimester, but by the time you get to the second trimester, you increase your calorie by 350 calories per day in second trimester. Then third trimester, 450 calories per day. Why are you needing more calories? Because you are burning a lot of calories. Your body's metabolism is up. Your baby is getting ready to be born. So you need adequate calories to do this. But don't go overboard. So for an optimal pregnancy, you should make sure that your food consists of whole foods, plenty of nutrients to fulfill yours and your baby's needs. So whole foods, your fruits and vegetables, drink a lot of water, get a lot of sleep, avoid processed junk food. If you can do all this, then you're on your way to having a very good outcome in this pregnancy. Okay, so that's my presentation. I'm going to give us an opportunity to ask questions in real time. So please, if you have any questions, go ahead and ask, and I'll provide you feedbacks in real time. Okay, so ask your questions, please. The clinic is open now for questions. Make sure when you're sending us email, it's Snowspiration, it's not Snowspiration. Some people make the mistake of not putting the S. When you don't put the S, it's not going to go. We respond to all our emails within 24 hours. So anytime you begin to have problems communicating with us, take time. Don't be in a hurry. Make sure you send us the right email. So for any services you're going for, when you send us email, you send us evidence, admin will process you and assign you appropriately. I don't consult in my inbox. Unfortunately, I have millions of messages there. The right place to consult with me is to go to subscription. Then they will give you access to my phone and you can consult with me. If you have 3 months and 6 months, we can schedule an appointment. I can talk to you. I can talk to your partner. I can refer you and we can begin to tackle infertility in real time. Okay, so guys, let's talk. Ask your questions, please. I want to use this opportunity to recognize a colleague of mine in UK, Dr. Adoma Anayo Chukwu. amazing lady, Ogechi, doing amazing things with medical students in Nigeria, which I happen to be part of the crew, training them. So thank you so much for attending our clinic today. We definitely appreciate you. Okay, guys, let's talk. Let's talk. Ask your questions, please. After breast cancer therapy, should you conceive again? Why not? Why not? Now, what you need to understand is this. Depending on the type of breast cancer you have, okay? If you have, you just mentioned breast cancer, right? I wanted to give, breast cancer. I wanted to give a general overview of all cancers, right? Now, if you have breast cancer and you've gone for your chemotherapy, you've gone for your radiotherapy, and you probably went for mastectomy. Mastectomy is the surgical removal of the whole breast. Sometimes we need to be radical. So radical mastectomy means we'll clear your whole breast tissues. We go to your armpit, we clear everything from your armpit because the breast develops from the armpits. Okay? So there's a place in the breast, in the armpit, we call it axilla in medical school. So we go there and clear everything. The problem in breast cancer is the fact that it can metastasize. So metastasis means it can start from one area and spread to the whole area in the body. So the key word in dealing with cancer is time of diagnosis. If we can catch cancer on time, we can remove it completely. We can go aggressive. We can go chemotherapy. We can do radiotherapy. But here's the problem. If you have cancer in your reproductive area, that's the whole female growing area, the whole reproductive system, you can have damage to the ovaries. You can have damage to other structures, your tube, your womb, your cervix, and all that, your vagina. So the key word is the damage, level of damage. So if you underwent radiotherapy and chemotherapy or surgical correction of any of those cancers about the female reproductive system, you have to follow instructions from a fertility specialist. If thankfully your eggs are still intact, in some cases, when we want to go for all this therapy, we collect the eggs. So unfortunately, if a woman has cancer, if her ovaries are good, the ovaries can still give you a baby. So we collect the eggs from the ovaries, then we go ahead and do whatever we want to do. Once we are okay with the treatment, then we can go back and we can either use IVF or you go for surrogacy. So the fact you have cancer doesn't mean you can't start your family. Now, in the event that your cancer was actually complicated or it has metastasized and your body cannot, thrive during pregnancy, then we won't advise you to become pregnant. The state of pregnancy can affect your body in so many ways, including depressing your immunity, predisposing you to developing a lot of infections and other things. So our key word is not just becoming pregnant. Our key word is the outcome of the pregnancy. So in our group, we are not just interested in helping you to become pregnant. We are interested in helping you to become pregnant, sustaining your pregnancy, and having your baby in your hands. So who would decide in your own case will be the oncologist. So oncologist is a special doctor that deals in everything cancer. So run it by your doctor. They will assess your reproductive potentials. They will assess your ovarian reserve, assess your partner sperm count, quality, and motility. Then they can decide. So don't be in a hurry. Don't be in a hurry. Don't go for pregnancy that will be complicated and your life might be in danger. Okay? Always think about the outcome. Okay. Okay. So how soon can you go for IVF procedure after myomectomy surgery? So here's the deal. Myomectomy is the surgical removal of fibroid in the body of a woman. There are principally three types of fibroid. You have the subserosal fibroid on the body of the womb. Then you have submucosal fibroid on the lining of the womb and intramural fibroid. So three types. Now, depending on the type of fibroid you have, it will determine the outcome of your fertility. So any fibroid that is inside the womb, two types, intramural and submucosal fibroid, can affect your ability to become pregnant in the first place and can also affect the outcome of that pregnancy. So some fibroids can lead to miscarriage. Now, if your fibroid is relatively big, bigger than 6 cm, giving you symptoms and a couple of other things, then it's advisable you go for myomectomy. If you're going for your myomectomy, it's advised you go for fertility-sparing myomectomy. Fertility-sparing myomectomy means you only remove the fibroids. You don't damage any other structure within the vicinity of where you're removing the fibroid, so your fertility can be preserved. So you can still go for pregnancy, you can still go for any other procedure after removing the myomectomy, after removing the fibroid. Okay, so it's possible. Okay, guys, let's continue. All right. Okay, so let me read what Dr. Ogechi said. Food products in UK, correct. They gave labeling and all that. Let me continue reading. Okay, they label it exactly the amount of calories. Very important. In Nigeria, most times the apple, the amala, the diabetic stuff, they don't really label all that. So that's a problem with Nigerian food. So you need to be careful, okay? All right, let's continue. Please keep asking your questions. So in regards to going for IVF, okay? When you've gone for myomectomy and it's fertility sparing, you've done the right things. So follow up with the IVF provider, they will assess. So I wouldn't advise you to go for IVF with big fibroids. It's gonna be wasting your money. So if your fibroid is relatively big and they are inside the womb and are giving you a lot of symptoms, you definitely want to remove it if you're going for IVF. IVF is a very expensive procedure. You don't want to go there, waste millions, and it won't work. Okay? All right, let's continue, guys. Okay, and thank you, Dr. Ndiche, also in the house. So we have enough, Dr. And Ogechi, you can also take questions. Ogechi is a very solid lady in UK. So you can also take questions that it's related to your area of discipline, okay? All right, let's continue, guys. Please keep asking your questions. Okay, good evening. You're the first time watching me, and what's causing overflow during menses? So it can be anything. It can be any of the gynecological problems. Top on the list is fibroid. So women that have symptomatic fibroid means the fibroid is big. The fibroid has distorted your whole cycle. So if you suddenly notice that your period is heavy, it's extended, it's painful, then please go for gynecological assessment. So it might be fibroid. It can be anything. Okay. Let's continue. Please keep asking your questions. Ogechi, you can take care of any question in your jurisdiction, okay? Can a pregnant woman eat sugarcane? Why not? But everything is all in moderation. Your sugarcane is simply sugar, okay? But be mindful, if you're eating it, you have to wash it properly. Anytime you're eating any food item, make sure it's properly washed, especially in this era of so many communicable disease, okay? So I know when I was in Nigeria, I love my sugarcane. I think the last time I ate sugarcane was when I was in secondary school. I would definitely give anything to eat that. But guys, you're pregnant. Now, there's another important beverage that so many people consume out there, your Zobo. Your Zobo and your alcohol is in the same category until proven otherwise. So no Zobo. Zobo is included. In your pregnancy, don't take Zobo. Okay? Okay. If you don't, I'm trying to understand you. Do you mean if you don't see your period for 3 months, then I'm worried. Any woman that hasn't seen her period for 3 months and you're still within your reproductive phase of life, you're not up to 40, you haven't gone into menopause, then I'm worried. Once you haven't seen your period for 3 months, it's called amenorrhea. Now, one of the things that will be an outcome of not seeing your period is pregnancy. So once you don't see your period and you go for pregnancy test and you're not pregnant, then you need to see a gynecologist. We need to know what's going on. If you have not seen your period for 12 months, 12 consecutive months. So if you're in this union now, since January 2021, December 2021, you didn't see your period. It's 12 months. You need to be worried for the right reason. So you need to go and see a doctor. We need to confirm you haven't gone into menopause. So the classical presentation of menopause in women is lack of period for a period of 12 months. Then dryness, hot flushes, mood swings, and all that, which is related to menopause. Menopause is not a disease condition. Menopause is a transition that all women will go through. When you go into menopause, you no longer have eggs. You can no longer use your eggs to become pregnant, but you can become pregnant when someone gives you another egg. So 3 months, I'm worried. Now, please, I wouldn't want any member of our community to identify a problem. Then they won't do nothing. If your problem is infertility, you don't have a baby, then you need to seek help. You cannot afford to be trying other things, trying herbs, trying clomid, taking advice of your friends without seeing the right doctor you need. Now, if you've already told you that you need IVF, please don't delay. The best time to start your IVF is in January. So if you need to be referred for IVF, please touch base with us. We'll refer you. Now, I have only few doctors in Nigeria. And the reason is very simple. There are some good guys out there. Then there are some bad guys. So if I can communicate with a doctor I'm referring you to, that I won't refer you to. I want someone I can communicate with. I want someone that will give me a report. I want someone we can co-manage because I'm in America. I'm not in Nigeria. So be careful where you're going to. But if you have a problem, identify your problem and go for solutions. The best person to help you if you want to become pregnant is who? A fertility specialist. Now, if you are already pregnant, be careful. You have to have a doctor attached to you. There are 3 things you must do when you're pregnant. You must check your urine test, you must check your blood test, and you must do ultrasound. Until you've done your ultrasound, you are not clinically confirmed pregnant. You are chemically confirmed pregnant. So urine test, blood test, chemical pregnancy is a different coined terminology from the other chemical pregnancy, which is an abnormality. It's only when we see that you have gestational pole, gestational sac, and they are inside your womb that we can clap our hands and we can go to town and we can begin to jubilate that you have pregnancy. Some pregnancies might not be viable. Unfortunately, some women will have ectopic pregnancy, molar pregnancy, missed abortion, blighted ovum, and a couple of other things. So when you have non-viable pregnancy, it means you are pregnant, but unfortunately, your baby is not going to come to term. So you need to be careful. Now, when you've confirmed that you're pregnant, you register for your ANC on time. There is nobody in this community, you're pregnant and you don't have a doctor attached to you. And we have a healthy community. We have a group of pregnant women in our Telegram. So you can go there, you can start from your first trimester and run it through your whole pregnancy. Very important to have a doctor attached to you. We have saved thousands of babies by quickly going to the hospital when we saw bleeding, when we saw water coming out of your body, or you have lower body pain, lower back pain. There are some symptoms that will freak you out in your pregnancy. Bleeding of any shape or form, water coming out of your body, and pain. If you have any of these 3 things in your pregnancy, especially during the first trimester, please go to your doctor immediately. It's possible your pregnancy is threatened, okay? Very important. Okay, your surgery has been done last December. You actually want to know how soon. Touch base with your doctor. Don't go shopping for doctors that don't have your medical history. You see, if you're asking me when you can go and I tell you to go tomorrow, I'm not doing you justice. Why? Because I don't have your medical history. I don't have your surgical history. I don't know the type of surgery you went for. So always go with the same doctor that did the myomectomy, the same doctor that is managing you, then go with the terms they give you. So let me repeat your question. When can you continue your IVF procedure? You go back to the doctor that requested you to go for the surgery. If it's myomectomy, you go back for post-surgical appointment. We check and make sure you're fully recovered. Anytime you have surgery, you have to go for post-op appointment. We have to check the womb. We have to make sure it's properly healed from inside. You don't have infection. Then we have to make sure you recover physically, emotionally, spiritually, and you're ready. If you rush to quickly become pregnant, you're going to put yourself in danger. The same thing is applicable to new mothers. Don't rush to become pregnant. There's a lady that had her baby in September. By January, she's already pregnant. And she was asking me if she can be breastfeeding. How can you be pregnant and have a baby in September, then by December, you're pregnant again? You're not giving yourself a break. So allow 18 months to elapse before trying. So not even giving birth, trying 18 months so that your womb will recover. You see, when you're pregnant and you have your baby, your womb takes a lot of heat. There are so many things that happen here. We have to replenish. You have to recover before you go again. When you go quickly, you can be in danger. And part of the danger can be death. Okay? All right. So thank you for coming. I think I've attended to all the questions, and Dr. Ndiche also helped. And I believe Ogechi, probably you saw one or few questions you can attend to. But guys, if you need help, subscribe. Okay? Now, I normally do this in all my clinic, especially on weekends. Have you named your babies? Have you named your babies in 2022? How many babies are you believing God to have in 2022? Have you named them? Have you decorated their room? Do you want to have a boy, girl, twins, triplets, quadruplets? Please, can you quickly put the names of your baby on the screen? Every singular mother to be in 2022. If you're in your last trimester, I'm sure you've packed your bags. Every woman that graduates to last trimester, that's the third trimester, pack your bags up. Your babies can come like a thief in the night. Blink, your baby is on ground. Okay? And the good thing, If for some reasons your pregnancy was challenged and your baby comes before 37 weeks, that baby is called preterm baby. In pregnancy, we aim for 37 weeks. Once you cross 37 weeks, the possibility your baby will be fine is high. Once you are not up to 37 weeks, when you give birth to that baby, we retain the baby in neonatal intensive care unit. We want to make sure that the baby will be good before the baby can go home. When your baby comes early, it means that your baby will still want to be in an environment that will mimic the womb. When we take the baby to neonatal intensive care unit, we are recreating the mother's womb. Your baby must reach 37 weeks before your baby can come out. Now, an average pregnancy is meant to last for 42 weeks. There is no healthy pregnancy that should last beyond 42 weeks. Once your pregnancy has gone beyond 42 weeks, we have to bring that baby out. You can go for induction, you can go for augmentation, or you can go for CS. There is no baby that should be allowed to elapse 42 weeks. So the concept of this lady was carrying her pregnancy for 2 years, for 3 years, is completely what we call DOA, dead on arrival. There is no such thing. All babies must be brought out by 42 weeks. Have your delivery plan. If you're attending your ANC, when you go next, ask them that Dr. Chudi asked for a delivery plan. Every pregnant woman should have a delivery plan from last trimester. Now, at 36 weeks, the position your baby will assume will likely be the position your baby will come. So if you're lucky and your baby is presenting with head, no problem. But if at 36 weeks, your baby is presenting with buttock, with side, or breech, then we'll likely consider a couple of options, including CS. Okay? But get ready. It doesn't matter how your baby comes. If your baby decides to come through the vagina, that's okay. If your baby decides to come through assistance or CS, we're okay. We just want to see the woman laughing and the baby crying and the baby in your breast. That's all we want to see. So we don't want to compromise any of our babies. In the past, we've lost babies, we've lost pregnant women. We don't want that to happen in our group. So by default, by third trimester, pack your bags. Labor can come by 1 a.m., 12 a.m., 3 a.m. You must head to the hospital. It doesn't matter if we have a world war. The only people exempted from any emergency, anytime, any day, any hour are pregnant women. Once you're pregnant, they can grant you any access. In a developed, civilized country, it's supposed to take less than 5 minutes to admit you if you're pregnant and you're going to the hospital and you have complications. This is why you need to make sure you register in a good hospital. There are some pregnant women that will register in health center. Recently, I think this morning, a guy in UK was telling me about the wife. You know, he's in UK studying and he registered the wife to be going to a specialist. The wife preferred to be going to a health center instead of going to the specialist. Eventually, they lost the baby. Now they've been having long-term infertility. You do not want to become pregnant because of your complacency, because of your ignorance, then you lose your baby. Becoming pregnant now, it's tough. I don't think there is anything that can compare to the difficulties and the challenges that so many women are going through. Now, if you have been looking for a baby for a long time and you eventually become pregnant, don't run away. There are so many women who will help to become pregnant, they quickly run away. Then when they begin to have complications, they will come back. When you are pregnant, it's not over. It's only over when we've delivered the placenta. Until the placenta is delivered, your pregnancy has not ended. Your pregnancy ends when the placenta is delivered. So long as the placenta is inside your body, your baby can be crying, but you're in danger. We need to deliver the placenta. So until you have your baby, the placenta out, and your baby in your bosom trying to suckle, the journey of pregnancy has not ended. You need to be careful. Very, very, very important. Okay? All right. So I want to believe that any other outstanding question have been attended to. If you need to consult with me, start today. Do not postpone your action time. 2022 is execution, the year of execution, not the year of planning. So if you have been planning to go for IVF, stop planning. Start tomorrow. If you have been planning to see a fertility specialist, stop planning. If you have been planning to subscribe for 1 week, 1 month, 3 months, 6 months, do it today. Don't allow today pass you by. Do it right now, today, and talk to your partner. Have you had your family meeting? Have you run around the figures? You know, what are the priorities? What's your biggest priority as a family? If you don't have a baby and your priority is to have a baby, invest in the infertility. Go to the best. Don't compromise standards. Some of us compromise standards by 50,000, 20,000. Then you go to a place, you lose your baby because of 10,000, because of few coins. What's money if you can't get the best thing that will make you happy? So consider investing in your health. Don't invest in things that don't matter. Some people went to church today. You gave lump sum of money to the pastor to pray for you. The best person, I've been captured this for me. The best person to pray for you is you. Look, we all have fathers, we all have mothers, we all have parents. Do you need to apply for a visa to talk to your parents? No. So nobody should be your representative to your parents. You have a direct access. You can go to the dining table and sit down and eat every single thing there. So don't allow anybody deceive you by siphoning the money you will need to go and do what you need to do. You can pray from January to December and God will answer your questions, your answers, your problems. God can do that. But don't allow anybody monetize your infertility. I've been captured that for me too. Don't allow anybody monetize your infertility. There are so many people that are happy you're having infertility. So they want to use it to put fear. Oh, don't do this. Oh, do that. Go here, go there. We're going to give you this. We're going to give you olive oil. We're going to give you holy water. Go here, go pray. Some people are praying. They are not making love. Some people have checked into the prayer houses. They are not meeting with their partner. How can you become pregnant if you and your partner are not making love? So these are very simple, common sense things. Okay, so please, while you're praying, which we encourage, everything is all about prayer. If you follow me, I recognize God, because without God, I won't be talking to you guys. So, but when you have said your prayer, you have your own duty. You have to meet with your partner 48 hours. Now, some people will attend my clinic since 2015, and they still show up and say, Doc, calculate this for me, calculate that for me. We don't do ovulation lovemaking in this group. We don't do fertility window lovemaking. What do we do? 48 hours. Matter of fact, if you are not bleeding, you have an advantage. Because some women will not bleed, but they will become pregnant. The key process that must happen before you become pregnant is ovulation. So some women, for some reasons, it might be a lot of things, they are not bleeding, but they are ovulating. Some newly delivered mothers will not bleed, but if they make love, they will become pregnant. Why? Because they can release their egg before the first bleeding will come. So make love around the corner. The more you make love, the more you're increasing your chance of becoming pregnant. And this is my prayer for you. We are all going to become mothers and fathers in 2022. So who has shared the names of their babies? Let's quickly round up and, go get some rest. Okay? All right. Share the names of your babies quickly so we can go. Okay? All right. Okay, I'm just seeing few. Zimchika Chim and Zikora Nachindima. Beautiful name. It's going to happen. It's going to happen. Okay? All right, share the names of your babies quickly so I can go. Okay? All right. Well, I'm not seeing names, so I will assume you don't want to have a baby in 2022, right? So I'm probably talking to all pregnant women, which is good. So if it's only pregnant women I'm talking to and nobody wants to have a baby in 2022, then we thank God. That means we are doing the right things. Okay? But guys, thank you for coming. We appreciate the admin. We appreciate all the doctors that helped today. And the next time I will see you guys on Tuesday, the YouTube clinic. So YouTube clinics on weekdays will be 6 p.m. No, not 6 p.m. 1 a.m. It's supposed to be my 7 p.m. But we'll see what we can do to see if we can come a little bit early. So be on the lookout. We might make it 6 p.m. my time, which might be your 12 a.m. Nigerian time, okay? So guys, thank you for coming. I appreciate you guys, okay? Zuri and Zara, Chiziteren, Daniel, Daniela, and all that. Ogechi, thank you for dropping by. I appreciate you. Oluwa Feremi, Oluwa Darasimi, Oluwa Tobilola, and Oluwa Femi. That's 4 quadruplets. You will think that God is a joker. God is going to give you 4 babies. Before you pray for any baby, make sure you want them. Some people want boys, they get girls, they don't love the girls. Some people want girls, they get boys, they don't love the boys. It doesn't, look, if you are not ready to love your babies, don't bring them forth. Some people just want to go and adopt. Some people just want to go for donor egg, surrogacy. Then that baby comes, you're not loving that baby because you feel you're not the mother or the father. It doesn't make sense. If you know you can't love that baby, don't adopt that baby. Don't go for IVF. Don't go for anything. But please, if you want to have a baby, if you want to be a mother, no age can stop you. Any woman can become a mother at any age. There is no age limit to become. Capture that for me. Big capture. There is no age limit for becoming a mother. at any age before you die, you can be a mother. The question is how. So the question of becoming a mother is how. So at age 80, can you be a mother? Yes. How? Adoption. At age 70, can you be a mother? How? Adoption. At 60, can you be a mother? Yes. How? You can go for surrogacy. You can go for donor X through IVF and all that. And you can be a mother. At 50, the same thing. So the older you get, the more your options are limited. There are some women that the only way they can become mothers in 2022 is IVF. Now, if you went to church today, and God has already told you you have to be a mother of 3, 4 or thereabout through IVF alone. But you go to church, your pastor will tell you, oh, let's bind and cast IVF. What are you now doing? You're binding and casting the only method that God says He's going to use to bless you. So you have to decide what's good for you in this era of confusion all over the place. Your pastor and your church is meant to guide you. If you go there and you don't understand the message, decide for yourself what will make you happy. You are not looking for societal validation. You are looking for things that will make you happy. So long as you want to be a mother like other women, which I will encourage you, the love a mother has for her babies is incomparable. It's indescribable. Okay? So please go above and beyond. Make sure you register for the Male and Female Infertility Summit. Ogechi will also extend a hand of fellowship during that event so you can come and understudy. I've been working with Ogechi with medical students in Nigeria, teaching them, mentoring them, and all that. So when we go for this event, we're going to extend a hand of fellowship so you can come and understudy and see what we do for women in Nigeria and globally. Okay, but until I see you guys on Tuesday, thank you for coming, and we appreciate our admin for making our time and taking good care of us today. God bless you. I'm going to make my transcript available because this topic is very important. So if you're a pregnant woman, be on the lookout for this. I'm going to share my transcript. Please remember, low mercury containing fish, no raw meat, no raw fish. Wash all your food products. No coffee, no zobo, no alcohol, no soda. Okay? If you do all this, you're in the right track. God bless you and enjoy the rest of your weekend. Bye-bye for now.